ankle joint. Ankle joint, we are going to discuss the ankle joint in the following headings. That is the introduction. Next will be the articular surfaces. Next will be the ligaments. Next one will be the relations, blood supply, nerve supply, movements, and finally will be the applied. So now in the introduction, we are going for the first the ankle joint. Okay, the ankle joint, it is also an important weight bearing joint. It is formed by the lower surfaces of the tibia. So if you see, this is the right sided tibia. Okay, this is the lower surface of the tibia, right? This is formed by the lower surface of the tibia with the lower surface of the fibula. Fibula is not with me now. Okay, this is formed by the lower surface of the tibia with its medial malleolus, with the lateral malleolus of the fibula. Both will be articulating with the talus. So if you see, this is the this is the foot bones. This is the bones of the foot. In this is the talus. Okay, this is the superior surface of the talus. If you see the superior, this is also called as trochlear surface of the talus. If you see the trochlear surface, this trochlear surface along with the inferior surface of the tibia with the fibula. Okay, with the lateral malleolus of the fibula will be forming this joint. So in the introduction, it is formed by the lower surface of, it is formed between the tibia, fibula and the trochlear surface of the talus bone, and it is an hinge joint of synovial variety. Okay, it is a synovial variety joint belongs to, it is a synovial joint belongs to the hinge variety. So the carryover point is it belongs to the hinge. It belongs to the hinge variety, okay, of synovial joint. Okay, and it is formed by the lower surface of the tibia with the fibula and the trochlear surface of the talus. Okay, now we will go detailing into the articular surface. Okay, if you go into the articular surface, just I am drawing this is the fibula, right? This is the lateral malleolus of the fibula, and this will be the tibia with its medial malleolus, right? This will be the medial malleolus and this will be the lateral malleolus, and here I will draw the talus, right? Here it will be the talus, right? And lower down it will be the calcaneum. Okay, let it be the calcaneum. So this will be the talus, okay, and this will be the calcaneum. Calcaneum will be little bit big. Okay, this will be the, so this, let it be the talus, this will be the calcaneum, this will be the medial malleolus of tibia, and this will be the lateral malleolus of fibula. Okay, and the medial and the lateral malleolus of the tibia and fibula are connected by a ligament that is called as tibiofibular ligament. That is called as inferior tibiofibular ligament. Okay, so these are forming the articular surfaces. So now the articular surfaces are formed by the, so this will be the trochlear surface of the talus. Okay, so here will be the trochlear surface of the talus, right? So the articular surfaces, now the articular surfaces are formed between the lateral malleolus of the fibula, inferior surface of the tibia with its medial malleolus, inferior tibiofibular ligament, and the inferior articular surface is formed by the trochlear surface of the talus. Okay, so what is tibiofibular mortise? Okay, so tibiofibular mortise. What is meant by tibiofibular mortise? The tibiofibular mortise is nothing but the three things. What is that? Lateral malleolus, the tibiofibular, inferior tibiofibular ligament, and with the medial malleolus, inferior surface of the tibia with the medial malleolus. This together, what is that? Lateral malleolus, next inferior tibiofibular ligament, right, with the tibia, inferior surface of tibia, with medial malleolus. Okay, with the medial malleolus. All this will be forming the tibiofibular mortise. Don't get confused. Only this area forms the tibiofibular mortise. And from laterally, we will have the lateral ligament, okay, connecting to the talus. And from medially, we will have the medial ligament that connects to the talus. Okay, so together all this will be forming the ankle joint. Okay, so this is about the articular surfaces. Above will be the tibiofibular mortise and below will be the trochlear surface of the talus. Now we will go for the ligaments. Okay, so what are the ligaments? Laterally we know that there will be the lateral ligament, and medially we will know that there is the medial ligament, right? So what is medial ligament and the lateral ligaments of the ankle joint? Okay, in the articular surfaces only, we have to cover a little bit about the talus. Okay, so in the talus we have, see, if you see, this is the right sided leg. So this is the medial side and this is the lateral side. If you see the medial side, there will be a comma shaped facet on the talus that is articulates with the medial malleolus of the tibia, right? If you see laterally, there will be the triangular shaped facet that will be articulating with the lateral malleolus of the fibula. Okay, so proximal articular surface is by the tibiofibular mortise, and the distal articular surface is formed by the talus with its medial comma shaped facet, and the lateral, it is lateral triangular facet, right? So this is about the articular surface. Next we will move for the ligaments. In that ligaments, if we see, first we have to draw the ligaments. Okay, so medially we have the medial ligament or the deltoid ligament. Okay, it is most commonly called as deltoid ligament, and in laterally we have the lateral ligament. Okay, so these are the two ligaments that is present on the medial and the lateral side. How to draw that? So now first we have to draw the medial side, means we have to draw the medial side. We have the navicular bone, right? So medial side we have the navicular bone. So I am going to draw now the navicular bone. Okay, so this is the navicular bone, right? So this is the navicular bone, and I have to draw the talus, right? So this is the talus, and here I have to draw the calcaneum. So this is the calcaneum. So medial side, we can see the navicular bone, talus bone, and this is the calcaneal bone. Okay, so so medial side we have, and one more important bone I have to draw from here are the tibia with its medial malleolus. Okay, tibia with its medial malleolus. Okay, now the ligament should be drawn from here. Okay, so this is the deltoid ligament, which is an important thing. The deltoid ligament that stabilizes the ankle joint from the medial side. So it is attached. How it is attached? So it has an superficial fibers and the deep fibers. Okay, the superficial fibers, again it is divided into three parts. Okay, the superficial fibers divided into three parts, that is they are, so medially, so anterior, so superficial fiber, so deltoid ligament, I can write here the deltoid ligament. Deltoid ligament has superficial fibers, deep fibers, right? So superficial fibers and the deep fibers. Superficial fibers, again we are dividing into three parts. What are they? So anterior, okay, anterior, this is tibio, right? Anterior tibio navicular fibers, that attaches from the medial malleolus to the navicular bone and also to the spring ligament. So this is nothing but this is the spring ligament. So spring ligament. So this is the fiber that arises from the lateral malleolus to the navicular bone to the spring ligament. So this fiber is called as anterior tibio-navicular fibers. Tibio-navicular fibers. This is one of the part of the superficial. Next is that comes from the medial malleolus and it ends in the calcaneum. Okay, so that will be we can name it easily. What is that? Tibio-calcaneal fibers. Tibio-calcaneal fibers, right? And next, from the posterior aspect of the medial malleolus to the talus bone. Okay, so this we can call it as tibio-talar fibers and posterior tibio-talar fibers. Okay, so this one is called as anterior tibio-navicular, middle tibio-calcaneal, posterior tibial talar. So these are the three parts of the superficial fibers. If you go for the deep, so we have the posterior tibio-talar. So the deep fiber is called as anterior tibio-talar. So from the tibia it goes to the talus, right? So that is called as anterior tibio-talar. So deep fibers is formed by the anterior tibio-talar. Okay, and this superficial fibers has three parts. They are anterior tibio-navicular, tibio-calcaneal and the posterior tibio-talar. So these are about the deltoid ligament. So deltoid ligament is one of the strong ligament that stabilizes the knee joint, stabilizes the ankle joint from its medial aspect. It is divided into superficial fibers and the deep fibers. The superficial fibers again has the three parts, that is the anterior tibio-navicular, tibio-calcaneal and the posterior tibio-talar. And if you see the deep fibers, that is the anterior tibio-talar. Now we will go for the lateral ligament. Okay, so the lateral ligament will be present on the lateral side of the ankle joint. So how to draw that? So now first we have to draw the talus. So this is the talus and calcaneum. So this will be the calcaneum and here will be the cuboid. Calcaneum and here will be the cuboid. Right, and over the talus there will be the here will be the fibula with its lateral malleolus. So fibula with its lateral malleolus, right? So now what are the fibers? What are the ligaments that connects here? Okay, so the lateral ligament has very easy, it has an anterior talofibular, right? Posterior talofibular. Very easy, no? So anterior talofibular, posterior talofibular and middle it is from calcaneum to fibula, right? So only these are the three fibers that the three parts of the lateral ligament. What is that? Anterior talofibular, posterior talofibular, okay, and middle, that is calcaneofibular. Right? So these are the three parts of the lateral ligament. So these are the two important ligaments that give stability, that give strength for the ankle joint. Okay, so that the medially, that is the medial ligament, and laterally that will be the lateral ligament. So this will be the talar, calcaneum, and this is the fibula with its lateral malleolus. So these are the parts of these are the ligaments and its important parts of the ligament. So next we will go for the relations. Okay, for the relations, I'll draw the talus. I will draw the talus. Let us consider here will be the comma shaped facet for the tibia. Okay, lateral malleolus of the tibia. And here will be the fibula. Okay, here for the fibula and here will be the tibia. Okay, so this will be the anterior. Okay, this will be the posterior compartment. So this will be, let it be the medial side, this will be the lateral side. Okay, so now what are the muscles that crosses anterior? This here will be the anterior and here will be the posterior and here will be the lateral, right? Here will be the lateral. Okay, this medial, anterior, posterior. Okay, so now what are the muscles that crosses the ankle joint anteriorly? So first talus, tibia, fibula. So anteriorly from medial to lateral we have the tibialis posterior, right? Tibialis anterior. Anteriorly from medial to lateral we have the tibialis anterior. Then we have the flexor, what is the muscle anteriorly will be the extensor hallucis longus, extensor digitorum longus, and finally there will be the peroneus tertius, right? And there will be the anterior tibial artery and the deep peroneal nerve between the tibialis anterior and here. Okay, so there will be the anterior tibial artery and the deep peroneal nerve. So these are the things that forms the anterior relation. If we see the posterior relation, there will be the flexor retinaculum, right? So there will be extension of flexor retinaculum and there will be the, what are the muscles posterior medially? So medially it is related to, from medial to lateral, tibialis posterior, and I will draw in this color only. So tibialis posterior, okay, and then flexor hallucis longus and the flexor digitorum longus. So these are the three muscles that will be related to the medially. Laterally, if you see, we have the peroneus longus and the peroneus brevis. Peroneus longus and the peroneus brevis. Medially, if you see, we have, along with that, what is the nerve? Posterior tibial artery with the posterior tibial artery with the nerve, that is the tibial nerve. So this will be forming the posterior relation. Okay, so this is forming the medial relation, this is forming the lateral relation, and this is forming the anterior relation. So the anterior relations of the ankle joint is formed by the, what is this muscle? This muscle is the tibialis anterior. This one will be the extensor hallucis longus, extensor digitorum longus, peroneus tertius, right? And the medially it is related to posteromedially. We can keep it as ankle joint is posteromedially. It is related to the tibialis posterior, flexor digitorum longus and the flexor hallucis longus, right? And this is related to the posterior tibial artery and the deep and the tibial nerve. And this is laterally it is related to the peroneus longus and the peroneus brevis. So this is about the relation of the ankle joint. Okay, now if we go for the blood supply, we know anterior to the ankle joint we have the anterior tibial artery and the posterior to it will be the posterior tibial artery. So both the arteries will supply the ankle joint. And if we see the nerve supply, the anterior to the ankle joint, there will be, we know that it has the deep peroneal nerve and posterior to it we have the tibial nerve. So both the nerves will be supplying the ankle joint. And if we see the movements, so now we are coming to the movements. So this is the normal ankle joint. So this is the plantarflexion, okay, and this is the dorsiflexion. Okay, during dorsiflexion, if you note, see, during the dorsiflexion, the trochlear surface of the femur, trochlear surface of the talus, which moves backwards, so that the anterior end, which is broader, will come and fit into the tibiofibular mortise, so that this joint will be it's stabilized. Okay, and it is more stabilized in this position, that is in the dorsiflexed position. The tibiofibular mortise will be occupied by the anterior broad end of the trochlea. So it is stabilized and strong in the dorsiflexion. Similarly, this is the plantar flexion. What happens? The posterior end of the talus, which is narrow, that fits into the tibiofibular mortise, which is so lax and the unstabilized position, so that any dislocation, any injury will be more unstabilized position will be in the plantar flexed position and more stabilized position will be the dorsiflexed position. So always the dorsiflexed position, the ankle joint will be strong and the stabilized. So the two movements of the ankle joint are the plantar flexion and the dorsiflexion. Right, and for the dorsiflexion, the muscles responsible will be the dorsiflexion. The muscle responsible will be the anterior compartment muscles. That is all these muscles: extensor hallucis longus, extensor digitorum longus with the peroneus tertius. So the muscles responsible for the dorsiflexion will be the anterior compartment of the leg muscles. Similarly, for the plantar flexion, the main muscles that is responsible will be the soleus and the gastrocnemius. Okay, for the plantar flexion, the superficial muscles of the posterior compartment of the leg, that is the medial and the lateral head of gastrocnemius with the soleus, will be acting as the plantar flex for the plantar flexion. Right. So these are the muscles mainly responsible for the plantar flexion and the dorsiflexion. Right. So now applied aspect. So in the applied aspect, what we have to see is, so we know that here in this picture only I can draw the medial ligament as well as the lateral ligament. Right. So what will be this one? This will be the medial ligament, and this one will be the lateral ligament. Here is the fibula and here will be the tibia. Okay, so this will be the medial and the lateral ligament. So which ligament is strong? We know that already, the deltoid ligament, that is the medial ligament, is so strong in the ankle joint. So what happens during plantar flexion, during this position? Okay, during inversion. So during extreme inversion, what happens? The lateral ligament will be stretched and it will be torn out. Right. So during the extreme inversion, what happens to the extreme inversion? We think that ideally speaking, the deltoid ligament will be cut, but really what will be happening? The deltoid ligament is so strong so that it will not be torn and torn. Instead, it will take out the tip of the medial malleolus of the tibia. So the more prone is, that will be the fracture of the medial malleolus of the tibia in the extreme inversion. In the extreme inversion, there will be the breakage of the lateral ligament, but in case of extreme inversion, instead of breakage of the deltoid ligament, there will be the breakage of the fracture of the medial malleolus of the tibia. That much strong is that deltoid ligament.